Hi friends, this is Dr. Abdequaem Chimthanawala. Today I'll share a case in which I prescribed a very rare drug. That drug I had never ever studied, nor I had prescribed it before that case. The patient came with a very unique and peculiar symptoms in this case. He said, okay, sir, I have formication in my upper limb, left hand especially left hand, and sometimes right hand also, sometimes in the both upper limb, but more in the left hand, and it is more here. The formication is more here. चीटियां यहाँ पे आती है. I said okay. Now, if a patient is very specific in telling you symptom that there is a formication in the upper arm, upper extremities, especially over the wrist, and sometimes formication is here. He said sometimes the formication is here. So he was telling us sometimes it is the whole arm, but more here, that is just above the wrist to the elbow joint. These were the complaints. I said something else? Like, no sir, बहुत cheat है, समझ लगता है. Doctors have prescribed me some vitamin tablets. Till that time I take, I feel better. But then this is very irritating. Then I have to always massage my hand. Then I feel better. Now this is because of formication. And sometimes I have pain only here on the wrist. Only pain on the wrist. And the doctors say maybe it is starting of arthritis. I have pain in the wrist. Sometimes both the wrist and in the wrist. I said something else in the lower extremity, something else symptoms. No sir, this is on the upper extremity and in the lower extremity, in the calf muscles, I feel excruciating pain. And his wordings were ऐसे लगता है कि अपन जब गिर जाते हैं तो कैसे अपने को मार लगता है मांसपेशी में, उस प्रकार का मार लगता है मेरे को. That means the patient was trying to tell us कि extremities feel bruised, especially in the legs, especially the calf muscles, and especially more in the left calf. He was very sure that he was only having this symptom. He said, sir, relieve my these two symptoms, 4 or 5 symptoms, and I'll be happy, because whenever I go, doctors just prescribe me tonics, and if they say if you have a lot of pain, take this painkiller, but don't take it more, otherwise it may cause harm in the body. So this was a case in front of me. Now if you see this case, there is not much symptoms in this case, except for there is formication in the wrist. There is formication in the wrist, above the wrist also. There is formication in the upper extremities, formication just above the wrist, and the fourth symptom was extremities, bruised pain, especially in the left calf. Now we also, my assistants also gave 3-4 medicines, but the pain was better till the patient took the medicine. Once they stopped, it was again back to square one, and the case came to me. And the symptoms, when we analyzed the case and wrote the symptoms in the repertory chart, a very rare drug came in the prescription, in the repertory chart, and that was Ulmus Rubra or Ulmus Rubra. You pronounce it like ULMUS, Ulmus Rubra, RUBRA. A very rare drug, and to be frank, I had never ever used this drug in this condition, nor I had ever read this drug before this case. But after this case, I have about 4 to 5 cases with the same symptom and the same prescription, Ulmus Rubra, 202 doses, and they all are better. So sometimes the patient comes and teaches us new remedies, then you must have an open mind to see and continuously read the symptoms, so that you can prescribe a better similimum. Because there is a difference between a partial similimum and a difference between the similimum. Of course, there were a lot of other mental symptoms, and if you add this mental symptoms, these acute, precise symptoms, you can make a drug picture of the drugs which are not proved at length. I'll not tell the mental symptom because they were very common, but if you add this mental symptom to this physical symptom which we have prescribed for Ulmus Rubra, then you can get a mathematics of the symptom of Ulmus Rubra, which contains the mind symptoms also and the body symptoms also. Then it makes a complete drug picture of Ulmus Rubra. If you get this symptoms in your OPD and if you get results, please do contact me so that we can develop mathematics of rare drugs also. So my friends, if you like this video, please do share and subscribe. Thank you.